Hi everyone, my name is Dr. Inaka Yembe. I am a foreign medical graduate, currently licensed to practice and board certified in the United States. I am right now sitting in my call room just doing what I love to do best, taking care of patients. It's really my calling. I love to help people every single day. This video is for the foreign medical graduate who is trying to get into residency and become a licensed physician within the United States. The reason why I put together this video is I've received so many calls and feedback and just questions from people who are struggling to get into residency. So I've come up with a webinar series. If you are a foreign medical graduate, I encourage you to follow me and learn from me the strategies and simple tips and things that work for me, and I hope they work for you as well. Just very briefly about myself, I was born in Cameroon, Africa. I did my medical degree in Milan, Italy. I graduated in 1997. I came to the United States in December of 97. I did my step 1 exam in August of 98. And the step 2 shortly after that. I was pregnant with step 1 and step 2. After I passed the exams, the first time I applied to about 150 programs, I had 0 interviews. The second time, I figured out what my problem was. I had been advised by several people. I did a lot of work. I dropped the idea of going into a big program that was, one of the top of the line. I also dropped the idea of becoming an ophthalmologist because my scores were not so great. I mean, I passed, but they were not fantastic. And the second time I applied to 350 programs, I had 2 interviews, and I matched into one program for transitional medicine. I started off there. I got offered a position to do internal medicine in that same program, which I really did not want to do. I chose to go to a smaller family medicine program in Monroe, Louisiana. I came down here in 2012, stayed here since then. I love the area. Mostly it was a small program where I could learn as much as I could. I was a very curious resident. I did as much as I could. I graduated as the resident of the year in 2005. I was also the baby catcher of the year after catching over 100 babies in 1 year. So I worked very hard. Shortly after my graduation, I was faced with a medical illness, but then when I recovered from that, I accepted a position as a family medicine faculty. And so I have been on both sides of the equation here. I have been an applicant, and I have also been in a position to select applicants. And so I would give you just a few tips that would help you. The biggest thing that I wanted to share with you is that be encouraged, because there are foreign medical graduates like me and others who have made it through the system. If we can make it, you can too. You need to really encourage yourself and understand that the process is difficult. There will be many stumbling blocks, but you can do it. You can do it. That's the first thing I want you to think about. The second thing is that you have to burn your ships. When I came to this country, I had no other alternatives but to become a licensed physician. I'm not saying I did not work. I worked to help myself financially, but I did not think ever of another profession. I did not want to be a nurse, as I had been advised. I did not want to be a CNA. I did not want to be anything else. I did not want to be a physician assistant. I did not want to do public health. These are the things that I was advised to do instead of the of any residency program, because it was hard, I was told. That was not an option for me. My only option was eventually to get into a residency program, which I did. So I literally burnt my ships. There was no retreat for me. I want you to think about that and remember that always. Don't give yourself easy alternatives to fall back onto, because it's so easy. I figured out 4 different categories of international medical graduates. And when we start the webinar series, there will be 4 different webinar series, and you will have specific tools and skills that I think will help you overcome this hump. Firstly, the first category of IMGs are those who just come to the United States and never, ever take the boards. They research different tools and different things to help them study for the boards. They speak to different people. They do a lot of research, but they just never take the boards. Why is that? Because they get discouraged, then they start to lack self-confidence, and then they get overwhelmed with different kinds of hardships, financially, family, just different things that happen, and they just never get to take the exams. My advice for you is, number one, no matter how hard it is, it's always going to be hard. Being a physician is not easy. I work. Sometimes I sit here for 60 hours a week. It's hard physically. You get used to it, and you can overcome that if you truly have a passion for it. So I don't get tired while I'm working. I get tired when I stop working, but not during. So take that board exam as a job. It's something that you can do, and it's something that you will have to work very hard and overcome your struggles and your difficulties and run away, shut down all the negative voices that come at you from within and from outside of you. Take your board exams because you came here to become a licensed physician. So please, please do not be discouraged. I'll have some more tips and some more tools for you later on in the first webinar series. The second category of people are those who take the board exams and fail. First and foremost, the board exams are standardized tests. What that means is that these are a series of tests that put every applicant at the same level. Everybody taking step 1 takes the same standardized tests, or USMLE1. So as a foreign medical graduate, sometimes that could be challenging for us depending on how we even went through our studies. For me, for example, I came from Italy. All our exams were either oral or essay. I did not have any multiple choice exams, so I was not familiar with the multiple choice exam process. Secondly, my entire medical knowledge was in Italian, and I was studying these things in English. I have just several tips and tools for you to help you take the exam, take it and pass it well. The biggest thing you have to remember, taking step 1, step 2, or step 3 is a full-time job. It's not a part-time job. It's not something that, okay, you spend your whole day doing different things, come back home in the evening and study for 2-3 hours, and do that every single day for 6 months, and you are studying for the exam. It does not work for that, like that. You have to block yourself out for 4 months at a time. Close down the parties. You can even close down, I don't know, the children. When I had my children, I sent them home to Africa to my mom. I had to make that sacrifice of staying away from the obligations that I had with the children for a couple of years so I could do what I had to do. You have to block that time. It's a full-time job. If you came into this country to take step 1 and step 2, you should be studying for at least 10, 12, 14 hours a day, every day, for 3 to 4 to 6 months. Make that sacrifice. Secondly, there are question banks that you must make this a part of your study process. There are review materials that you must review. And lastly, there are NMBE exams, and these are a question bank exams that you take, and they are somewhat equivalent with the level of the USMLE exams. The reason why you take this is, number 1, to know what your strengths and what your weaknesses are, and to study and focus on your weaknesses so you get better. Lastly, there's a clinical skills exam, which is part of the step 2 exam. I've seen most foreign medical graduates make a mistake of just watching the videos of the patient encounters and think they have now mastered it. No, you have to put yourself in an exam scenario. Take your brother, your sister, your best friend, whoever, to practice on. You have to practice the scenario 10, 20, 30 times. Write down the clinical notes. Read your clinical notes to make sure they are right. Practice, practice, practice the clinical exams. That's how it is done, and that's what will give you a good pass. Because guess what? Residencies, They don't like for you to fail the exams. Multiple attempts also will decrease your chances of getting into residency. That's number one. And number two, some residencies have a cutoff point, meaning your score is too low, even though you passed, they may not accept you because they have other candidates that are shining, that have better scores than you do. So you increase your chances by passing the exam and having a good score in the process. The third category of IMGs are those who pass the boards and do not get into residency. Okay, this is one of those that is a little bit painful because you've got your boards now and you do not need to be out of the medical system or the medical educational process for this long after you pass your exam. So I encourage you to evaluate your application process. I know that, yes, it's nice to go to the big university to have the great education, but you really need to spend a lot of time doing research. Look for programs that are IMG friendly. That's the key. They have to be IMG friendly, and that would increase your chances of getting into that program. Secondly, look for disciplines that are not as competitive. Remember, when I came into this country, I wanted to be an ophthalmologist because my aunt was an ophthalmologist and she was my role model. That changed after my first year of trying and failing, and I settled for family practice, which I love now. I love family practice. But at that time, I made a choice to apply for any primary care discipline because my chances of getting into primary care were higher than, for example, getting into ophthalmology or dermatology. So don't try to get into a very competitive discipline. Or yes, you may apply for the competitive ones, but also have a good number of not so competitive specialties that you will apply to. Very important. So your application, do a lot of research. During this time that you are an applicant or to be an applicant, you should try to become familiar with the programs that you will apply to. What that means is go there, go see them, try to maybe do some research. Most programs will not accept for you to come in and do an observership anyway, but they do have some volunteer or some research opportunities. You can be a volunteer in a hospital, and guess what? All of a sudden, you will be allowed to attend the morning report for those residents, and you'll be allowed to go into the noon conferences. Go there so the people become familiar with you. Can you imagine if you've been just walking around a hospital and attending these different things, and now they know you're a resident who's doing a volunteership here in this hospital and you plan to apply here next year? Of course your chances are higher than people who they don't know. Another thing for you to remember during your application process is your letters of recommendation. Okay, foreign medical graduates, listen to this very carefully. Number one, your letters of recommendation should come from American-based physicians. Yes, most of us know that. Secondly, please waive your rights to view your letters of recommendation. Very important. If you view your letters of recommendation, that drops your chances of getting accepted to that program, because then the program failed. Did you not trust the person who wrote the letter of recommendation for you? So why do you have to view it then? Right? So you apply, please waive your rights to view that letter of recommendations. Very important. Keep in mind, these programs have 2,000-3,000 applicants. They may have just 20, 30, some programs have even 8 or 9 positions only. It's an overwhelming number of applicants. You don't want your application to be pushed aside just because of a few things. Low scores, you viewed your letters of recommendations. The letters of recommendations were not even from American physicians. So think about those things. So that's the third category of international medical graduates. The last category I'll tell you are those who passed the board exams, they got into residency program, and something happened along the line, and they lost their position in that residency program. Please, international medical graduates, even American-based or people who studied in the United States, lose their positions as students. Sometimes something happened that is unique to you that made you lose your position. That's one thing. The second thing is that all is not lost. Please, all is not lost. What you need to do is to go back, look at the situation at what happened, figure out how you can overcome or solve or improve the problem, and go to another program and apply. And while you apply, please disclose that problem to this new residency program. Tell them what happened up front and tell them how you acknowledge the problem, how you plan to overcome it, because guess what? We all make mistakes. Residency programs appreciate people who are honest, people who want to work, and people who know that if I make a mistake, I acknowledge it, it's my fault, and there are things I can do to overcome it. So all is not lost, even if you lost your residency position. So that's it for now. Wait for my webinar series. I'm very excited about this. I want to help as many people as possible. Foreign medical graduates, we need to be getting into the residency programs and become the physicians that we want and pursue our dreams and our goals and our God-given missions. Thank you.